right, I'm going to be talking about coping with COVID-19, the efficacy of distraction for coping with the chronic stress of a pandemic. Hope you enjoy it. So, the starting point here is coping and regulatory flexibility, which is generally shown to be pretty adaptive. I'm showing you here now that coping strategies, when you use, like, let's say one for multiple different types of situations, may not be as effective as if you are able to use different coping strategies that depend on the situation that you're in. This idea of strategy situation fit is that depending on the demands and attributes of the situation, you want to go ahead and select a coping strategy that fits those demands and attributes. The COVID-19 pandemic presented a particularly new and interesting way to understand these types of stress situations that we're going to try to cope with. The pandemic was highly uncertain, it was very, very intense, and it's quite prolonged. And I want to make the claim today that we think that disengagement coping might be a particularly adept way of coping with these types of stressor attributes, in particular because disengagement coping, which involves removing yourself from the stressor and doing other things, doesn't depend on having lots of quality information to work with. So it can work with and address that high uncertainty. It also has been shown to be pretty good at interrupting emotional activity, which might help with the intensity of the pandemic. And it can provide a reprieve, particularly important for prolonged stress situations. So what we did is in April 2020, we measured disengagement coping, and particularly focused on distraction, which is kind of just distracting yourself momentarily to help make yourself feel better, and avoidance, which is avoiding thoughts and dealing with the stressor in its entirety. We also measured emotional well-being, and we did so at 3 time points, 1 week apart in a longitudinal design. And what we're really trying to look at is the relationship between disengagement, coping, and emotional well-being concurrently. So, like this week's feelings and this week's coping on this week's feelings. Also, habitual, like how if you habitually use it across the 3 weeks, how does it predict your overall well-being? And whether disengagement coping at one time point predicts changes in well-being at the next time point. First, we just measured sort of how often they use these strategies. And what we found was something really interesting, which is that people really liked using distraction as a coping strategy. It's very popular. Avoidance, not as much. Okay, and in fact, distraction was used more so than were other engagement coping strategies that were really trying to address the stressor at hand, which we thought was kind of interesting and speaks to maybe the utility of distraction coping during this pandemic.
Then we use longitudinal models to assess these other relationships. So we use multi-level models to look at concurrent relationships among coping and well-being, as well as a random intercept cross-lag panel models, which allowed us to disentangle the habitual relationships between coping and well-being, as well as lagged relationships between coping and well-being.
So if you look at concurrent relationships, we see that distraction use predicted nice positive, good positive emotions concurrently. Interesting, avoidance also actually predicted positive emotions concurrently, but also predicted a lot of negative emotions and stress. Habitual relationships look much the same as concurrent relationships. And in lagged relationships, we see that distraction doesn't really do much anymore, which suggests that distraction may be much more of a momentary reprieve. Really helps you feel better in the moment, and maybe not something that's going to help you feel better long term. Whereas avoidance has a strange relationship where it predicted decreased negative emotions the next week, but also increased stress. So it's not really clear what's going on there. So the takeaway from this is that disengagement coping is a part of coping flexibility, and that it's possible that some forms of it, especially distraction, may be particularly useful in pandemics. And they're for sure popular in pandemics, as well as any other stressors with similar attributes as this pandemic. And with that, thank you to my team, as well as my funding agency, and thank you for listening.